Hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall. Um, and I want to welcome you to this week's Value-Based Care Exhibit Hall Flash interview. And this week's guest is Craig Thomas, and Craig is the founder and CEO of Lucerna Health. Just a short intro on that. Lucerna Health offers its clients healthcare data management, patient engagement, and a number of analytic solutions that can help maximize value-based care goals and objectives. And Craig's going to tell us a lot more about that in the next few minutes. So all that said, welcome, Craig.
Yeah, thanks, John. It's great to see you again. And we're really excited to work with your exhibit hall and some of your participating companies, as we go forward here.
Well, thanks so much. I just have a couple of questions, Craig, today, and I think your answers will give us a much better understanding of Lucerna's capabilities. Only two questions, so let me ask question number one. Says, why is Lucerna Health working on advancing value-based care, and why Lucerna?
Okay, great questions, John. First, if you think about the goals of value-based care, lowering costs, improving health outcomes, improving provider and patient satisfaction, those are pretty important goals for their system here in the US. And so we find that to be an important and motivating purpose for the company to go after. So that's the first thing. The second, I would say, is that there's a couple strategies that a lot of people talk about that are important to making value-based care work. One is healthcare consumerism, or patient engagement, member engagement, which we have, our team has decades of experience in. And the second one, which I think is a really interesting differentiation strategy, and that is these emerging payer provider alliances, where they're really working closely together, not just, entering into new forms of contracts and maybe sharing a little information, but sharing data, integrating processes, collaborating, having transparency as a way to really advance value-based care for the payers' members and the providers' patients. And the last one for me is I find it very motivating and interesting to work with forward-looking companies and forward-looking leaders. And, to make change, if you're a legacy payer or a hospital system and move away from fee-for-service to value-based care, it takes a little bit of courage and persistence. And, the opportunity to partner with those kind of folks and those kinds of companies, is pretty interesting. And I think your second question was, well, okay, why Lucerna Health? Well, I would start with we've done it, and we've done it successfully for, 6 or 7 years now, with some very advanced payers and an advanced value-based care, primary care, and specialty group here in the US. We now support over 600,000 patients, all market segments, Medicare, Medicaid, ACA employer, multiple states. And we've driven tremendous results across a broad range of use cases. So experience and a proven playbook would be probably the thing that would be most important to people. The second one is we've developed what I think are 3 very strong interlocking capabilities. The first is our data management, integrations, and analytics platform, which we call LEAP, which roughly stands for the Lucerna Engagement and Activation Platform. And that's at the center of everything that we do. And our view is for this to work, you really have to know a lot about the patients and the providers and be able to match them and measure, access to care and quality and those kinds of things. The second one is we have a sophisticated patient engagement capability with a proven catalog across the whole series of use cases. And those are data-driven, omni-channel communications campaigns. And the third one is probably, in the end, the most important, and that is we have a great experienced team. We know technology, we know consumerism, we know the payer world very deeply, we know the provider world, very deeply. So without the team and the know-how, this is hard stuff to do. So I would say those are the 3 capabilities that we have that we've built out to support the strategies I talked about.
Okay.
And
Can you tell us just to close out, what is Lucerna's approach to working with customers?
Yeah, this is, I think, as just as important as the capabilities and the strategies and all of that. The first thing, every market's different, every company's different, where they're at's different. So you can't go in with, here's a cookie cutter approach to your challenges. You have to meet them where they are. So we start with a very collaborative, almost strategic design and planning type process. The second thing is, if they buy some of our specific products like the data platform or engagement, we do it in a way that's not a heavy lift for the customer. They're busy. A lot of them don't have a lot of people to do this kind of work. So we've got to make it easy for them to install it, deploy it, without too much hassle on part of the customer. And then last, we really focus on measurable value. And if we're not creating value, if people aren't using our services be super happy with the progress, then we're not doing our job.
Well, that's a great approach, and those are some much needed capabilities for value-based care organizations. So just want to say, everyone, for more information, following Craig's great answers, please visit the Lucerna Health booth in the Value-Based Care Exhibit Hall. And there's a lot of information there. See the little resources button, you click on that, it'll bring up some additional information, deeper dive, if you will, into what Craig has shared this morning. So I want to say thanks so much to everyone for joining us, and special thanks to you, Craig, for taking your time to talk with us.
Yeah, likewise, John. Thank you. Have a good day.
Thank you. Bye now, everyone.